Are you always flooded with a lot of questions and doubts about hearing loss and hearing aids information? Hi, my name is Athirah, founder and chief audiologist of Sound Life Hearing. Welcome to my YouTube channel, Sound Life Hearing. On this channel, we cover topics from hearing loss, hearing aids products, hearing test treatments, and service to guideline on how you can have better hearing. We will occasionally also host and broadcast different experts such as ENT doctors, pediatricians, and speech therapists to share their professional insight of different hearing loss issues and solutions. Listen to the real people with real experience about their hearing loss rehabilitation journey with Sound Life. By sharing this testimonial from our own clients, we hope to educate and create more awareness so that you may take your first steps to getting better hearing back to your life. Subscribe and hit the bell icon for notification so that you won't miss out on our latest videos update. Don't forget to check out our how-to tips and tricks of using hearing aids properly and some latest hearing aid brands video all sort out nicely in one place. Stay tuned and see you all soon.
Hi everyone, welcome to our Facebook Live today. My name is Hoyan from Sound Life PJ, and alongside with me today we have Kak Ili, my senior from another branch. And maybe Kak Ili, you want to introduce yourself?
Hello everyone, welcome to our Facebook Live today. My name is Athirah. I'm audiologist from Sound Life Setia Alam. Today we will talk about what to do if you have hearing loss. If you yourself or someone you love is struggling with hearing, this session is for you. Stay tuned until the end so you have more information and guideline on what to do if you notice you have a hearing loss. Feel free to drop comments in our comment box. Feel free to drop question as well. We will answer them live.
Okay, so today we will talk about what to do if you have hearing loss. We will also touch a bit on the signs, causes, and solution for hearing loss. We move on to the first slide. Before we want to know about the causes, solutions, and signs, of course, we need to understand what is hearing loss about. So hearing loss is partial or your total inability to hear. After working for a while, I noticed some customers, they have misconception about hearing loss. They thought hearing loss is totally cannot hear at all. So it's either they can hear or they cannot hear, but it's actually false. Okay, so between normal hearing and having a hearing loss, there's actually a lot of levels in between. So some people can have mild hearing loss, moderate hearing loss, severe hearing loss, or profound hearing loss, and it can affect one or both ears. It can also eventually impact communication, social life, and mental health, which we will explain a little bit more in depth later. Okay, so how do you know when you have hearing loss? Next slide. Okay, hearing loss has to be diagnosed by a proper hearing test, a diagnostic hearing test. Okay, so after doing a hearing test, you would get an audiogram, which we also call it a hearing level graph. Okay. So from this audiogram, from this chart, you can see the vertical line is loudness. From the top would be the soft sounds. Towards the end, towards the bottom would be the loud sounds. And the horizontal line will represents the pitch from low pitch to high pitch. Okay, so this is an example of a normal hearing. You can see the crosses and the circle. The axis in blue refers to your left ear, and the O's in red refers to your right ear. So you can see both of the lines are now at about 10 dB-ish, okay? So in order for us to consider a normal hearing, your hearing level has to be 20 dB or better, okay? Next slide. So how do you understand the chart? Now we have given a few examples here. These are the everyday sounds that we hear lah, okay? So if these sounds locate below your hearing level, which means the sounds are audible to you, you can hear them lah, okay? So as you can see for this normal hearing case, most of the sound locates below your hearing level, which means you can basically hear all the sounds here lah. And whereas for speech sounds, okay, towards the left are the lower pitch sounds, for example like b, m, d, j, okay, whereas towards the right are the higher pitch sounds, for example like k, f, s, sh, okay. So again, all the speech sounds are located below your hearing level, which means all the speech sounds are audible to you, no problem hearing it, okay. Now we look at an example of a person with hearing loss. How will the audiogram look like? Next slide. Okay, so this is an example of a person with a moderate to severe hearing loss. You can see the hearing level for this customer is actually much lower compared to just now. Next slide. Okay, so this one is a bit different. Now you can see about 60% of the sound locates above the hearing level, which means sounds like water dripping, conversations, and birds chirping is inaudible for this customer. And whereas the louder sound, for example, like dog barking, the motor, the helicopter, this one is the louder sounds. Customer will have no problem hearing this. But generally, for everyday kind of communication, it's severely affected already. And in fact, you look at the speech sounds, all of them locates above the hearing level, which means in a normal environment, if we talk in a normal speed, normal tone, normal volume, this person will struggle to hear. And in fact, we need to shout in order for this person to hear lah. So if you ask me, this person needs a hearing aid or not, I would say yes. This one definitely yes. And also got customer ask me which is the perfect level to start hearing aids. From my experience, 40 to about 50, about mild moderate level, people will start to notice that their hearing level is a bit more noticeable, and that is when they start wearing hearing aids. What about your center, Kak Ili? Do you experience the same?
We would say it's the same, but we always advise patient if you're having difficulty to hear the conversation well, the daily conversation, please put on your hearing aid as early as you can, so that you can get maximum benefit from the hearing aid or other amplification devices.
I think this is a better answer. As long as you have hearing difficulty, then advisable to have the hearing aids on also lah. Okay, next slide. Okay, so before even considering doing a hearing test, how do you know that you might have a hearing loss? So these are some of the signs that you need to know. Okay, first of all, of course, people with hearing loss, they will have difficulty understanding speech, especially in noisy environment. Okay, and they have to frequently ask people to repeat themselves. Okay, another one would be turning up the volume, be it on the TV or on their phone. So sometimes we do encounter people in the kopitiam or in the LRT, they put on loudspeaker and it's very loud, but sometimes they might not aware that they are having hearing loss. So if you have friends or family having this habit, you might want to advise them to go for a proper hearing test lah. Okay, another common sign would be they struggle to hear high-pitched sounds. High-pitched sounds, for example, like children's voice or women's voice, or they have problem hearing doorbell. Okay, then another common one would be having tinnitus. Okay, they will hear ringing in their ears. So again, a lot of customers thought tinnitus is the one causing them to have hearing loss, but it's actually the other way around. Actually, hearing loss is the one causing you to have the tinnitus. Okay, so if you experience tinnitus or ringing in your ear, it's advisable to get your hearing checked lah. Okay, and lastly, withdrawal from social situations. Okay, with the signs above, people will eventually withdraw themselves from social activity because they cannot understand, communicate. They cannot communicate well, and then when people talk to them, they have to shout, and then eventually they won't enjoy social activities anymore lah. Okay. Next. Okay. How do you recognize hearing loss in children? This one, Kak Ili, you have
Yes,
more children in your center. Maybe you want to share about how to recognize hearing loss in children. How is that different from hearing loss in adults?
okay, for children, it's quite different compared to adult because they are still developing their speech and language. So
Mm-hmm.
usually the first symptom would be delayed speech and language development in terms of the milestone for this development are not reached according to the timeline. So we consider as a delayed development. So usually we will advise the parents to check the child's hearing first before starting any therapy, any speech therapy. Then second would be if the child is showing lack of response to sound. Let's say you are calling their name, they're not responding well, especially while they're playing,
Mm-hmm.
or and then you're calling them from the dining area and they are playing at the living room and they are not responding well. That's considered
Mm-hmm.
lack of response. There's thirdly will be frequent asking of what and sometimes they ask us to repeat the question or they will say apa something like that. It could be called a symptom or sign of having hearing loss in children.
Mm-hmm.
Then sometimes because nowadays children watching TV and also
Mm-hmm.
mobile phone, you may also notice same symptom as adult. The child may turn up the volume or they will ask the parent to like can secret increase the volume a bit. They cannot hear well. If the child can communicate, then sometimes they will utter those sentences. And then fifth would be difficulty in following instruction. At a certain age, maybe 2 years old or 3 years old, we should be able to follow one step instruction. Macam we will say, go put your bottle in the sink. Something like that. It's a simple instruction. Let's go shower. If
Mm-hmm.
they are unable to follow those instruction, it considered a symptom of hearing loss in children. And then probably unusual behavior, maybe the child tugging the ear or rubbing the ear. It could be the child could be having ear infection. It can cause hearing loss in children. And other would be sometimes the child will speak loudly or shouting when they are playing or while they are having a conversation. They will use higher volume of voice. So that would be another sign. And then some of the children, they have a higher tendency to have frequent ear infection, or we call it a fluid in the ears. This one will require ENT management. But in case your child having this issue, you should check their hearing because it may make their hearing drop to a certain level and having a fluctuating hearing loss. And then second last point will be not imitating sound or words. For children to develop normal speech and language development, they need to have a good hearing. So when they listen well, they can imitate the words well. So if they are not imitating well or not producing well, so it's considered red flag also. And then last will be inconsistent reaction to environmental sound. So let's say your child cannot hear well to we call doorbell, or let's say opening of the door. Someone came back come home, then open the door. If they are not responding well to those uh, everyday sound, so it's considered red flag as well.
Mm-hmm.
Next, please. Okay, earlier I mentioned about speech and language development milestone in children. Here are the samples. If you are using children book in from KKM, the blue or the pink book, you have a page on this development as well. So you can also monitor your child's language, speech and language development. So usually this will be the simple guideline. Let's say at 3 months old, you should be able to cooing, smiling, or making a sound a bit. And then at 6 months old, they will start babbling like mama, dada, something like that. And then by 1 year old or 12 months old, they should have one first word, meaningful word. It can be baby sound, can be like mama, but it's referring to makan or food. Or let's
Mm.
say dada referring to daily. So this is what we mean by first meaningful word. Okay,
Mm.
so then you can just see the milestone there. Please ensure your child achieve this milestone
Mm.
according to their age, and continue just check with the book as well. So let's say if you noticing they are not reaching the milestone, please check with your pediatrician or the
Mm.
nurse that you did check up with for vaccination and everything. So they should be able to consult you further.
Mm. Thank you, Kak Ili. That's very informative. We move on to the next slide. Okay, so we have understand signs of hearing loss. Now we move on to the type of hearing loss. So there are three types of hearing loss that you might get. Okay, but before we go there, let's look at the ear diagram. So basically, our ear is divided into three parts. Okay, the outer ear, the middle ear, and also the inner ear. So the first type of hearing loss is called the conductive hearing loss. So the conductive hearing loss usually means there is a problem at the outer ear or the middle ear. Okay. So an example would be earwax built up in your ear canal, or you have a punctured eardrum. Okay. Or you might have fluid in the middle ear, which is also kind of an infection lah. Okay. So these are the conditions that has to be managed by an ENT doctor. Okay. And for most of the time, this kind of hearing loss is temporary. Okay, but you have to seek for medical attention as soon as possible lah. And this one, uh, sometimes doctor will also ask you to do a pre and a post hearing test before and after the management to see if your hearing goes back to normal. Okay. The next one would be sensory neural hearing loss, which also means permanent hearing loss because this one involves the nerves. So this one affects the inner ear. So if you look at the inner ear portion, there is a snail-like structure called the cochlea. Okay, this is the inner ear. So once this part is damaged, it won't recover. Okay, which is why this is permanent kind of hearing loss. So the causes for permanent hearing loss is mostly due to aging, genetics, or noise exposure lah, which I will explain a little bit further later. Okay, so this one, most of the time doctor cannot do anything also for sensory neural hearing loss. It has to be managed by hearing aids or implants. Okay, so the next one would be mixed hearing loss, which is a combination of conductive hearing loss and sensory neural hearing loss lah. Okay, next slide. So what causes hearing loss? First of all, of course, aging is the most common cause we see in our clinic. So majority of our customers are elderly, and this one no doubt is caused by aging, lah, which is a gradual hearing loss as we age. It's a normal process as we age. Can't really do anything or cannot avoid lah. Okay. Next, we have noise exposure. Okay, so when you are exposed to loud sounds for a prolonged period of time, that can also damage your hearing. We do have a few customers coming in, not very old, about 40, 50 plus, but they have quite bad hearing loss. So when being asked, they say they are working in a loud environment for 10, 20 years. So this one, noise exposure, sometimes you won't get it immediate because it's a long-term effect. You might get it only years later and it slowly develops. So this is one of the most easy preventable causes that we can prevent lah. Okay, so have to be cautious in those kind of environment. Or wear earplugs and earmuffs. Okay, next we have ear infections. Ear infections can also cause hearing loss, particularly conductive hearing loss, and this has to be managed by ENT doctor as well. Okay, we also have head trauma or injury. For example, if you have a fall or a car accident, motor accident that had a major impact on your head, this one can also cause hearing loss. I've also seen a few customers coming in telling me that they was being slapped in the face. Okay, so when they slap the cheek, the face, somehow they kena the ear also. So until the eardrum is ruptured. So this one is also can also cause hearing loss lah. So have to be careful. Okay. Next we have medication. Okay. Ototoxic drugs means auto means ear, toxic means toxic lah. So meaning Ototoxic drugs are drugs that is harmful to your ears. Okay, not all medications are ototoxic. Only certain drugs, for example, like loop diuretics. So these are medication that used to treat hypertension secondary to heart failure or kidney disease. Okay, another example would be chemotherapy drugs. Okay, certain chemotherapy drugs might also be ototoxic, but this one you have to clarify with your doctor on the side effects lah. Okay, not all are ototoxic. Okay. Next, also we have certain health conditions, for example, like hypertension or diabetes, may also contribute to hearing loss. Next slide. Okay, how about treatment and solutions? Maybe we have Kak Ili to continue.
Okay, if you notice or you know you have a hearing loss, what would be the treatment and solution for it? And does it matter? Because sometimes patient will wait until the hearing loss get worse, then only they seek a solution for it. So usually we will always tell them early intervention will improve long-term hearing outcomes. Please find a solution as early as you can. Next, for untreated hearing loss, there is effect on the individual's lifestyle. So we will use this video to explain further about hearing. In terms of our hearing, it's actually part of your overall health. So it's considered one of your senses. So you need a good hearing. Hold on, can you pause the video for a short while, please? Sorry. Okay, you need to have a good hearing to have a good quality of life. So if you're not treating your hearing loss, like I mentioned earlier, there are a few side effects on your daily activities. One would be, untreated hearing loss affect you in many ways, I mentioned. First would be difficulty in conversing. I think Korean did mention earlier. When you cannot hear the conversation well, so you will have difficulty to have a good conversation or communication with the other people. So it may lead to social isolation because when you cannot participate well, you cannot respond well, so you tend to isolate yourself from that situation. So we call it social isolation, and it can lead to depression, yeah, because let's say that individual is extrovert. So for extrovert people, they like to talk, but when they cannot hear well, so they're isolating themselves on the social situation, and they're not getting their quota of talking, right? So it can lead to depression in that kind of individual. Next. And then for elderly, when you have hearing loss, sometimes it will affect your balance system. As our hearing organ, the cochlear structure that Hoyan showed earlier, is connected to our balance system. And when you have hearing loss, it does somehow affect your balance system of the body. So for elderly especially, it can lead to poor balance and causing you to have a fall and injury. And this quite can consider quite dangerous here for elderly, because when they fall, it requires time for them to recover. And then for hearing, when you're not given enough stimulation for the brain to process sound to a certain degree of hearing loss, you will lessen the ability for that individual to remember. It affects the brain processing.
Yes.
It leads to higher risk of that individual to have dementia and Alzheimer's disease. It depends on the degree of hearing loss, but over time it accumulated, so it somehow will increase the percentage of getting Alzheimer and dementia. Okay. Okay. Hold on now. Next. Okay. Next slide, please. Okay. Earlier we already showed what could be the impact if you're not treating your hearing loss. We will explain further what would be the solution if you have hearing loss. There are a few common options for someone who has hearing loss. First would be hearing aids. Then second is cochlear implant. Cochlear implant usually for severe to profound hearing loss. Then third is assistive listening devices. And last will be communication strategy. I will explain further, yeah. for hearing aid would be the most common solution for hearing loss. There are few types of hearing aid available in the market. This picture showed different style of hearing aid. There are behind the ear one. For behind the ear hearing aid, you need to customize your ear more so that it provides better fitting in your ear. Then the hearing aid will sit behind your ear. Okay? And then we have receiver in the channel. The receiver in the channel also sit behind your ear. Right? It has a small receiver, a small wire, and dome that will go inside your ear for the coupling method. And then last will be custom hearing aid. For custom hearing aid, there are few sizes on this. For custom hearing aid, usually can cover up to moderately severe hearing loss only. Next. Okay, for hearing aid, in the market at the moment, there are a lot of brands available in the market. For Sound Life, we carry Resound, Redstone, Oticon, and Phonak. Majority of the hearing aid able to provide crystal clear sound quality depending on the performance level of the hearing aid. And these days, hearing aid has smart artificial intelligence, AI personalization, depending as well on the performance of the hearing aid. And the hearing aid are compact and stylish design. If patient like to go for fashion color, there are red color, there is pink color, blue color for them to choose from. The standard color will be beige, maybe black. And then compact, in terms of compatibility, compact will be in terms of carrying the hearing aid, charging the hearing aid. So it help patient to have more convenient, to become more comfortable or easy to use for the hearing aid. There's rechargeable option and there is also disposable battery hearing aid. We will show a video on what could be the features that I mentioned earlier in terms of that is available in Phonak Infinio.
Welcome to a breakthrough in hearing technology, Audiosphere Infinio, the world's first hearing aid with a dedicated AI chip, 53 times more powerful than current industry technology. Audiosphere Infinio makes speech instantly clearer from all directions, so you'll enjoy being at the heart of the conversation. Because with clearer speech and less noise, you can focus on what's really important. Even group conversations with the most challenging background noise feel simply joyful, so you can connect, share, and unlock a world of possibilities. With the new Audiosphere Infinio, the only device with spheric speech clarity. Phonak. Life is on.
Okay, that will be a simple explanation on how the hearing aid works in helping you to hear better. Next slide, please. Okay, for hearing aid, actually there are few criteria or consultation that need to be done before we can suggest a good device for the user. Usually, please, we advise a patient, we always advise customer. Please work with a professional audiologist so that we can give a professional consultation based on your needs. And because we need to know your graph first, your type of hearing loss, like what you explained earlier, and we need to evaluate your lifestyle and preferences before we can recommend the best model for you. And for hearing aid, it's not a cash and carry for a product. Usually, it requires fitting and programming, and also follow-up services after your purchase. So, find Sound Life Hearing for professional consultation regarding hearing aid. Okay?
Yeah. Kak, before this, I want to ask you a question. Like, do you have any customers coming in with noticeable hearing loss, but they rejected hearing aid? They don't want to wear also. Like, what's your
I think
experience?
that will be common, especially among elderly. Usually they will brush off their issue Although the family member is already complaining, they are not listening well, they are screaming at the parents, but they are not taking any action. We have a hit, macam somehow kena tipu by the children, bringing them over for hearing assessment and consultation regarding hearing aid.
Yeah.
And happen to be the auntie is quite angry during the session because the
Okay.
student tu kan bawa dia keluar. And then happen to be is quite lengthy duration for first appointment. And but she smiled at the end of the session once
Oh,
we
that's nice.
put on the hearing aid, and he tried to have a conversation with the children. For her, she actually the main point is they don't want to susahkan the other. But actually, for us, we are children as well, so we don't mind improving our parents' quality of life.
Correct.
And it does help in terms of their emotional well-being and the relationship tension within the family.
I also have
You
another
have one,
experience.
right?
Yeah,
You
I
want
want
to
to
share
say
your
that.
story?
I have one customer with about moderate to severe hearing loss coming in with a wife. Okay. Obviously after the hearing aid trial, I mean he put on the hearing aid, he can hear us better and respond better. But this customer also have a very bad dementia, which he's also dependent on the wife also lah. The wife will take care of his everyday routine. So after they buy the hearing aid, the wife will wear the hearing aid for him every day. But the customer refuses to wear it, and after the wife puts it on, he will remove it and maybe he will put it in a drawer or hide it under the sofa because he don't want to wear it. So the wife has to look for the hearing aid every time he did that. So it's a bit difficult for the wife lah. So what I'm trying to say is, don't wait until it's too late to
Yes, true.
pick up hearing aids. Yeah, because you want to, you need to learn how to take it and manage while you're still active, while you still can handle it yourself. Then it became a routine. Then it wouldn't be so difficult lah. Yeah,
Yes, having a family support is very important for hearing aid user.
yeah. Maybe we
We
move
will
on to
continue with the next topic. Next slide, please. Or maybe Hoyan will explain further regarding cochlear implant.
okay, cochlear implant. It's a bit different from hearing aids because hearing aids is a small device that hangs on your ear. It basically amplifies sounds so that you hear better lah. It still go through the normal pathway, like I mentioned just now, the outer ear, middle ear, inner ear. So it still go through the normal pathway for you to hear. But for cochlear implant, okay, it bypasses the damaged part of the ear and directly stimulates your nerve. Okay, so for cochlear implant, it's best suited for severe to profound hearing loss or people who receive very little benefit or no benefit from hearing aids, then we consider cochlear implant. But this one, we need to go through some evaluations from the medical doctor, particularly ENT. So sometimes doctor will ask you to do CT scan or MRI, and then they will assess to see if you are physically and medically fit for the surgery. And then if yes, then only we will proceed the rest lah. Yeah, and next we will have a short video to show you how we successfully transferred a hearing aid user to a cochlear implant user. So we will see what he has to say lah.
Hi Michael, we knew that you were wearing superpower hearing aid before you have your cochlear implant. What was the problem you was having before you had the CI?
Before my cochlear implant, I had hearing aid. And a hearing aid has usually just to amplify the sounds. So I'm actually got through life really normal until COVID came. So when COVID came, everybody has to wear a mask. And for some reason, even I get the strongest hearing aid. I think that time I was wearing Oticon Superpower hearing aid.
Yes.
No matter what, no matter how loud the audiologist give my hearing aid, I couldn't hear. So that's the problem with me when people wear masks and I couldn't hear them.
So meaning to say that it's because of like you can't hear people when they were wearing masks, and before that you were still able to you still able to cope with your hearing aids because you still can lip read.
I guess I wasn't clear. Like that's one of the major problem. There are other few problems as well.
What are the other few problems?
I think the few problem is I could not really hear properly in the group,
I see.
and sometimes phone call or listening to the TV or video, or when a stranger call me. There are most of the problems I have when hearing it.
I see. So that leads to the decision you are having your cochlear implant.
Yes, that's right.
Can you tell us like what's your life now after you have your cochlear implant?
Fantastic, way better than before. As I said, I think when I was hearing it, I still didn't dare to dream big. I just like stay true my own life, go through the course, and I'm afraid to think of the future because of all the problems I have. And then with the cochlear implant, even though it's not perfect, but it's way better than having a hearing aid. So it made me dare to dream bigger and dare to ask for something which I may want to look for it.
I see. So over here, we hope that those like who wear hearing aids but still struggle to hear, maybe you can schedule an appointment with Sound Life audiologist for a CI consultation. Thank you.
Thanks for the video. Very nice feedback from our customer. Yeah, maybe we move on to the next slide.
Okay. Apart from hearing aid and also cochlear implant, we also offer assistive listening devices for a hearing aid user actually. Because sometimes when hearing aid, you may experience difficulty in certain situations, specific situation like classroom, meeting room, or group conversation, let's say theory or gathering. So sometimes the users still struggle to hear the conversation very well. We will advise them to take up assistive listening devices such as FM system. FM system will enhance the speech in noisy environment, like the picture over here. You will have Japan, you have Martin will assist them to hear the conversation better. And apart from that, we also have other brands as well, like Resound, Multimind. And if the user sometimes they will still have difficulty to hear the TV sound because the hearing aid still have limitation to hear sound from a speaker like TV very well, or let's say from the speaker like laptop, such as laptop and also PC. The user may have difficulty to hear whatever video or playing over that devices well. So we may recommend other devices to couple with the hearing aid. In the picture here, we have a Resound TV streamer. Usually we will install this device to their TV so that they can stream the TV sound directly to the hearing aid for better clarity. And then for a user that involved in a lot of meeting or let's say lecture or classroom, they may require speech to text, meaning that live transcription. We have assistive listening devices that may suitable in that situation so that they can have better understanding with a visual support from this live transcription. Next. Okay. For the last solution, when you have a hearing loss, usually we will also counsel about communication strategy. As we mentioned earlier, having a family members or friends that is supportive and patient with the individual would be the best situation. So usually we will counsel them to minimize background noise. When you have a lot of noises in your environment, sometimes the speech sound will be masked by the noise. So usually we will ask them to move away from the noise source. Let's say in kedai makan, kopitiam, sometimes the noise is quite loud. Or mamak, right? Sometimes it's quite loud in the environment. So we will ask them to find different table, maybe at the corner side, or more open space, more quieter area, so that they can hear the conversation better. And then, of course, please use face-to-face communication. When you are facing the speaker, you can see the visual cues, the lip reading, you can see the body language, so that you can have better understanding about the topic or the conversation. Okay, and then third, of course, rephrase instead of repeating. Instead of asking someone to repeat themselves, so you can just ask them to rephrase. Maybe, what do you think? Maybe the question is actually, what do you think about the meal? So you can actually rephrase. Oh, can you tell me about the food instead? Instead of asking them to repeat the question. Okay, you usually when you have a hearing loss, let's say moderate, mild to moderate, the user, the individuals can still hear the conversation to a certain level. Just sometimes they need to guess the word. They don't catch the whole sentence, so
Yes.
they can still catch a few words. So hence the reason we advise the individual to use a rephrase method instead of repeating method. Okay, and then last one will be try to summarize component of the statement instead of asking, it's not nice as well, right? Because it's important for you to say, apa? What are you talking about? Instead of doing that kind of gesture, maybe you can just summarize whatever you heard or to the speaker you're talking to. And then, of course, we emphasize as much as you can, be assertive. Please tell the others or the speaker you're talking to that you may have difficulty in understanding the conversation due to your hearing loss, so that will understand you better and assist you with the conversation. Okay, okay, this is a summary or solution for someone who has hearing loss. First will be hearing aid. Hearing aid help to emphasize sound for better speech clarity. And second, or you explained earlier, the cochlear implant. Cochlear implant is suitable for severe to profound hearing loss when hearing aids are no longer beneficial for the user. And then third would be assistive listening devices. This is to couple with hearing aid or cochlear implant. It helps in stressful situations like noisy environment and also for watching TV or football as well. The last would be communication strategy. It is a tips to improve listening and conversation for someone who has hearing loss. Next, please. Okay, what should you do if you notice yourself or your loved one has a symptom of hearing loss? First, of course, please get a hearing test to determine your hearing level from audiologists, of course, and the audiologist usually will give you a consultation for the best solution if you have a certain degree of hearing loss. And then the third would be the solution for your hearing loss. Please consider to go on hearing aid or assistive listening devices based on your needs. Okay, and then last will be stay for active. Regular checkup are important. Please treat hearing as part of your health, and usually advise patients to do annual hearing assessment. Okay, actually that will be it in terms of our session. We will move to question and answer. Feel free to drop uh, some question in our comment
We have
box.
one question.
We have
If we always wear earbuds or earphones, will it affect and reduce our hearing ability?
For this question, it will depend on the volume of your earbuds and how long you wear your earbuds or earphone. Because nowadays phone will have notification when you reach a certain volume level. So we advise patient to keep the volume at moderate level, half of the bar,
Yeah.
and take a break in between. Let's say 1 or 2 hours. Take a break from your earbud or earphone so that your hearing organ can have time to recover.
Yeah.
Take a rest,
Or,
I would say.
or you can also follow the 60-60 rule. Because how noise affects your hearing depending on two factors, like I really say, the volume and the duration lah. Okay, so the 60-60 rule will kind of control that. Okay, which is not put your volume more than 60%, which is like I really say about at most you put it at half, and not more than 1 hour. So this one you can control the exposure lah, and with that you can minimize the effect or the damage to your ears from earphones.
Yeah.
Yeah.
Okay, then second question. My grandmother likely to have hearing loss. What should I do? You can answer this.
Yeah, schedule an appointment with us. Bring your grandmother here, and we will check her hearing. We'll probably do a diagnostic hearing test and see whether she needs a hearing aid or not. If yes, then we will further consult on the hearing aids lah.
Okay, the same dulu.
Patut jumpa ENT dulu or audiologist dulu ya. What
If
do
you
you
have
think?
a hearing concern, you can just see audiologist right away. Book an appointment with us so that we can know your hearing level. If there is a medical issue upon the completion of the test, we will refer you to ENT for further assessment and management and review back your hearing.
Yes. Okay.
Any other question?
I guess that's about it. We have finished our session today. Thank you to everyone who
Hold on
tuned in.
now.
Oh, we have this promotion.
Sorry. Okay.
Okay.
For this month, we actually offering this month in conjunction of World Hearing Day, we are offering 50% discount for diagnostic hearing test. Our retail price for diagnostic hearing test is actually 110, but for this month until 31st March, we give a 50% discount with a net price of 55 ringgit. You can call us to book an appointment and schedule a diagnostic hearing test.
Valid
I
until
think
31st March. Yeah.
We have 3 branches.
Yeah. Oh, before we go
By the
into,
way, before we go,
yeah. We have another live session tomorrow with colleagues, our chief audiologist Athirah Cheng and also our senior Miss Teo. They will talk about things you need to take note before you buy hearing aids, but the session will be in Mandarin lah. It's also at 3 o'clock tomorrow, so stay tuned and yeah, remember to support us. Yeah, it'll be an
you can
interesting
follow our social media account. We are available in Facebook, Instagram, and also YouTube to have more updates and information related to hearing loss and also hearing aid.
Yeah.
For our branches, if you're interested in making appointment with one of our outlets, we have 3 outlets in Klang Valley only. Our HQ is in PJ, SS2 PJ. The contact number is there. And then we have second branch in Kota Kemuning, and that would be my branch, Setia Alam. We are open Monday to Saturday, 9:30 to 5:30 p.m. Except on Sundays, we are closed on Sunday. You can scan the code or you can call or WhatsApp us to book an appointment. We are appointment basis. We advise to contact us first before coming in.
Yeah. So
That
I
will
guess
be it.
that's it for today.
Thank you for tuning in and joining us during this live and sending us questions in our comment box. Hopefully you get informative information or knowledge from our session and share to your family members and friends if they need a hearing assessment.
Yeah. So thank you for all who tuned in today, and remember to support our Facebook Live tomorrow. Yeah.
Yes.
Our colleagues will see you again tomorrow.
Yep, you can ask further question regarding hearing aid tomorrow to our colleague.
Yeah.
That's all for today. Thank you.
All right. Thank you.